this, what tells you this is the right region? The tibia is on which side of the leg?
The outer. Or inner.
The inner.
The medial side. Tibia is medial, the fibula is lateral. Okay. What else do you need to know? That's not enough to get you properly oriented. You also need to know that this ridge here, called the anterior crest or anterior border of the tibia. So this is the front, this is the back, this is the medial side, the lateral side. That's enough. So you know the midline is here. You're seeing it from the front, so it's definitely on the right side of the midline, the anterior view. So yes, this is the right lesion. That's just the beginning. But wait, there's more. So what else do we have here? What bone is this?
Femur.
This is the femur. What do we have here? We have articular cartilage covering what process of the femur? Keep in mind, it's lined up with the fibula, so which side are we on? Lateral or medial? You can all join in, guys.
Lateral.
Lateral side. So this is articular cartilage over the lateral condyle of the femur. This is articular cartilage over the medial condyle of the femur, on the tibial side, the medial condyle. Here we have articular cartilage on the two condyles of the tibia. Articular cartilage on the lateral condyle, articular cartilage on the medial condyle of the tibia, right there. What bone is this?
Patella.
The patella, exactly. And what do we have connecting the patella bone to the tibia bone?
Ligament.
Patellar
Tendon.
ligament. Remember that a tendon joins a bone to a muscle. A ligament joins a bone to a non-muscle. So bone to non-muscle, bone to non-muscle. Right? So that's a ligament by definition. And it's one of the bones is the patella, so it's the patellar ligament. What's this? It's really one continuous object in terms of tissue composition. A tendon and a ligament are exactly the same. They're predominantly composed of what's called dense regular connective tissue. What differentiates them is what they link. So a ligament joins a bone to a non-muscle, and a tendon joins a bone, in this case the patella, to a muscle. So you follow this from the patella up, you go to the quadriceps femoris muscle of the anterior thigh. Quadriceps femoris muscles of the anterior thigh. So this is the quadriceps femoris tendon, aka the patellar tendon. Okay? Patellar ligament from tibia to patella, patellar tendon from patella to thigh muscle. Okay? Let's see. What do we have linking bone to bone? Tendon and ligament.
Ligament.
So which ligament is this?
The lateral.
Keep going. So far, so good.
Ligament of
The lateral, you're leaving a word out. There's a blank in the center there. The lateral blank ligament. Collateral.
Collateral.
Also called the fibular. The LCL or FCL. It's the lateral collateral ligament or the fibular collateral ligament. Right there. The fibula is the lateral leg bone. Okay, I should make this one a little easier. Another ligament from femur to tibia, or tibia to femur. So which is this?
Medial.
Medial collateral ligament or the tibial collateral ligament. It's the tibia, it's the medial leg bone. So this goes by either name. Medial collateral ligament or tibial collateral ligament. Okay? Let's see. These two little pads here. This one's on the lateral side. This one's on the medial side. These are the menisci. So this is the lateral meniscus. This is the medial meniscus. M-E-N-I-S-C-U-S. Meniscus. There's a little mistake on here. Here they have a ligament that should be, see it's loose there? That ligament should be attached to the tibia. Should be two bones. So you notice that gap in cartilage? So that ligament should attach to the tibia bone. The other end of that little ligament attaches to the medial meniscus. So this is called the transverse ligament. right here. The transverse ligament runs left-right transversely and connects bone to non-muscle, specifically tibia to medial meniscus. Right there. So that's you see the thing with the grooves in it? That is the transverse ligament. The menisci don't have any grooves in them. It's easier to tell them apart. What do we have here? Another bone-to-bone connector, so it's another ligament. Which ligament am I tapping? Well, what view is this? Anterior.
Anterior.
So this is the anterior cruciate ligament. Anterior cruciate, the ACL, spelled out. I'm not going to accept ACL in practical. Anterior cruciate ligament. I'm not going to accept MCL or LCL. I want the name written out. And what do those letters stand for? You can make up all kinds of names for those letters. So, anterior cruciate ligament, and in fact, you can also see the other ligament associated with it. That's the posterior cruciate ligament. Turn it around. Posterior cruciate ligament becomes easier to see as this upside down letter Y, but you can also see a little bit of the anterior cruciate ligament here too. Why cruciate? Why are they both called cruciate? Cruciate means crossing, forming an X. So the anterior posterior cruciate ligament cross each other and form an X. That's it for the knee joint.